Hi, my name is Rachel Saputo Abarca, manager with Blue Cross Blue Shield of Michigan. Welcome. Our presentation today will cover key terms and your out-of-pocket costs, your 2026 medical plan updates, understanding how your medical plan cost share works, choices for convenient care, how to get the most value from your medical plan, your routine hearing care coverage through True Hearing, Medicare basics and how Medicare works with your retirement system medical plan, and resources to help you succeed, including how to contact Blue Cross. Throughout the presentation, you'll see Medicare terms and benefits shown in purple and non-Medicare terms and benefits shown in orange. Information that applies to all members is shown in black. Let's talk about the key terms that are associated with covered services and explain how cost share maximums are a financial safeguard for you. Some services covered by your plan are paid in full by your retirement system, but most of the time you must pay a portion of the cost for your claims. These are the key terms you need to be familiar with. The amount you pay for covered services is referred to as your cost share. A deductible is the amount you pay each year before your retirement system begins to pay. Until you reach your annual deductible, you pay 100% of your covered medical expenses. The deductible for Medicare members and for non-Medicare members fully participating in the Living Well program is $800 and will not change in 2026. The deductible for non-Medicare members who do not fully participate in the Living Well program is up to $1,000 and will not change in 2026. You can learn more about the Living Well program in the Maximizing the Value of Your Plan portion of this presentation. Coinsurance is the percentage you pay for covered services after you've met your deductible. For most services you receive from PPO network providers, you pay 10% of the approved amount for the service. Your retirement system covers the remaining 90% of the cost. The PPO network distinction is important here because it affects how much you pay for services. While you pay 10% in coinsurance for most services received from PPO network providers, you'll pay higher costs for services received outside the PPO network, in most cases 30% coinsurance. You can learn more about in-network PPO providers and how using them can save you money in the Choices for Care portion of this presentation. A copayment, or copay, is a flat dollar amount that you pay for covered health care services. Your retirement system plan has a copay on 3 services: emergency room visits, urgent care visits, and routine hearing care. The coinsurance maximum is the maximum amount of coinsurance you'll pay in a calendar year for services received in the PPO network. Here's how it works. We keep track of the 10% coinsurance you pay throughout the year. Once you reach the coinsurance maximum, you stop paying the 10% coinsurance for the rest of the year. The good news is, just like last year, your coinsurance maximum in 2026 is $900. Let's take a look at the changes to your medical plan for 2026. If you're a Medicare member or you'll be eligible for Medicare in 2026, your emergency room visit copay will be increased from $140 to $150 per visit beginning January 1st, 2026. Remember, your emergency room copay is waived if you're admitted to the hospital within 72 hours. If your condition is not life-threatening, please go to your nearest urgent care office. Your copay remains $65 for urgent care services. We're making some updates to your Blue Cross member ID cards. Medicare members will be receiving a new member ID card in the mail before the end of the year, so please check your mail. Starting January 1st, 2026, you'll need to use your new Blue Cross member ID card for medical services. Your new member ID card will include your new enrollee ID number, new group number, and an issue date on or after November 2025. Once you receive your new member ID card, put it in a safe place. You'll begin to use your new card starting January 1st, 2026. But remember to continue using your previous member ID card, the one with an issue date before November 2025, until December 31st, 2025. A few things to remember about your new Blue Cross member ID card. You'll still have the same coverage. You'll begin to use your new ID card with an issue date on or after November 2025, starting January 1st, 2026. You can also access your Blue Cross member ID card online. Log into your member account at bcbsm.com/MPSERS or use the Blue Cross Blue Shield of Michigan mobile app to find your digital member ID card. You can learn more about the benefits of a Blue Cross online member account in the Member Resources portion of this presentation and your Medicare Resource Guide. For non-Medicare members, starting January 1st, 2026, your emergency room visit copay will be increased from $140 per visit to $150 per visit. Copays for emergency room visits begin after you've paid your annual deductible and reached your coinsurance maximum of $900 for 2026, which remains the same from 2025. Just like members enrolled in Medicare, the emergency room copay is waived if you are admitted to the hospital within 72 hours. If your condition is not life-threatening, please go to your nearest urgent care office. Your urgent care copay remains $65 for 2026, and for non-Medicare members, the annual deductible and coinsurance maximum must be met before the copay applies. Starting January 1st, 2026, you'll also have coverage of mental health and substance use disorder treatment at out-of-network outpatient facilities. When receiving services at an out-of-network outpatient mental health facility, the plan's usual out-of-network cost share will apply. You'll be responsible for the annual deductible and 30% coinsurance until the annual coinsurance maximum is met. Once the coinsurance maximum is met, you'll pay a 20% coinsurance out-of-network fee per visit. Your coverage for services at Blue Cross Network outpatient mental health and substance use disorder facilities has not changed. You'll pay the annual deductible and 10% coinsurance for these services. To lower your out-of-pocket costs, we recommend choosing network providers and facilities whenever possible. You can learn more about in-network PPO providers and how using them can save you money in the Choices for Care portion of this presentation. While some health plans are reducing benefits, I'm pleased to share that your retirement system medical plan is adding enhancements. Beginning January 1st, 2026, your retirement system medical plan for non-Medicare members will include coverage for the following preventive services at no additional cost when you use in-network providers. The preventive services included are abdominal aortic aneurysm screening, alcohol misuse screening, annual wellness visits, bone mass measurement, cardiovascular behavioral therapy, cardiovascular disease risk reduction visit, depression screening, diabetes screening, digital rectal exam, flexible sigmoidoscopy screening, hepatitis B screening, HIV screening, HPV screening when received with a Pap test, lung cancer screening, and lung cancer screening with low-dose computed tomography, obesity screening, sexually transmitted infection screenings and counseling, and tobacco use cessation counseling. So, whether you're a non-Medicare member or Medicare member, you'll have high-quality preventive services for $0 when using an in-network provider. Outside the network, non-Medicare members pay a 20% coinsurance out-of-network fee for these services. To better support your eye health needs, beginning January 1st, 2026, your retirement system medical plan will cover refraction tests with a medical eye exam for Medicare and non-Medicare PPO members. When you receive the service from a PPO network provider, you'll pay the annual deductible and 10% coinsurance until your coinsurance maximum is met. Outside the network, non-Medicare members will pay an additional 20% coinsurance out-of-network fee. Refraction tests measure how light bends as it passes through your eye and are used to determine the correct vision prescription. This is different from a routine eye exam and routine refraction tests. Your routine eye exams and routine refraction tests will continue to be covered by your retirement system vision plan. You can continue seeing your current eye doctor, so there is no need to switch. The biggest change is you'll no longer need to submit reimbursement requests to your vision insurance carrier for refraction tests done in conjunction with a medical eye exam. They'll be processed automatically through your medical benefits. We know that health insurance terms and how things work can be confusing. Let's take a closer look at how your cost share works by reviewing some payment examples. I'm going to walk through how the plan's cost share works using a couple of examples. This is Darren. Darren receives medical services over the course of the year. For the purpose of these examples, let's assume the following. Darren has an $800 deductible. This means he's enrolled in Medicare or he's a non-Medicare member fully participating in the Living Well program. However, if he was a non-Medicare member who did not fully participate in the Living Well program, he would have a higher deductible. Because he uses in-network providers, his coinsurance will be 10%. We'll also assume that Blue Cross has approved $500 to be paid for each of the services. Using this information, I'll show you how Darren's out-of-pocket costs are calculated and tracked on his online member account. In the first example, Darren has paid nothing toward his deductible before receiving medical services. First, we calculate how much he owes towards his deductible. Since his deductible is $800 and the approved amount of the service is $500, Darren owes $500 for the deductible. All $500 is applied towards his annual deductible and Darren owes nothing in coinsurance. The retirement system pays nothing in this example since Darren must meet the $800 deductible before the plan begins to pay any costs. As you can see at the bottom of the slide, Darren has now paid $500 toward his $800 deductible and nothing gets applied to the coinsurance maximum. In this next example, Darren had another covered service with an in-network PPO provider and Blue Cross approved $500 for this service. First, we calculate how much Darren owes towards his deductible. In the previous example, Darren paid $500 towards his annual deductible. This leaves a $300 balance, so Darren needs to pay $300 to satisfy his $800 deductible. You can see this under the amount owed toward the deductible column. Next, we calculate what Darren owes in coinsurance. Coinsurance is a percentage of the approved amount that you're responsible for paying after your deductible has been met. Because Darren used an in-network provider, his coinsurance is 10% of the approved amount. The deductible is applied before coinsurance. The 10% coinsurance is going to be applied to the approved amount after it's reduced by any amount paid towards the deductible. So you take the approved amount of $500 and subtract the amount paid towards his deductible, which is $300. The remaining approved balance is $200. 10% of $200 is $20. Therefore, Darren owes $20 in coinsurance. Now let's calculate Darren's total share of the costs for this service. Darren would first pay $300 towards his deductible plus the $20 in coinsurance. Therefore, his total out-of-pocket expense for this service would be $320. The retirement system would pay the remaining balance of $180. At the bottom of the slide, Darren has met his $800 deductible for the year, $500 from the previous service and $300 paid from this service. Darren owes nothing more towards his deductible. The $20 paid in coinsurance is applied to his coinsurance maximum. Now that the deductible is met, you can see that the retirement system is beginning to pick up its share of the cost. Darren will continue to pay coinsurance for future services until he has met his $900 coinsurance maximum for the plan year. With a Blue Cross online member account, you can check the status of your out-of-pocket costs easily. You can learn more about the benefits of a Blue Cross online member account in the Member Resources portion of this presentation. As a Blue Cross Blue Shield PPO member, you have many options for obtaining the right care for you and your family. With the 24-hour nurse line, you can talk to a registered nurse at no additional cost, day or night, and get medical advice. The nurse line can help you decide if you should head to the doctor or schedule an online visit, pick up over-the-counter medicine, or simply get some rest. Call 1-844-811-8460 and listen to the prompts to speak to a nurse. TTY users should call 711. You also have access to virtual care for minor illnesses and mental health care. When you're not feeling well and can't see your primary care provider or PCP, you can talk to a U.S. board-certified doctor about minor illnesses such as sinus and respiratory infections, cold and flu, or sore throat. You can also connect with board-certified psychiatrists, psychologists, and other licensed clinicians when you're dealing with stressful situations or issues such as grief, anxiety, or depression. Virtual therapy and psychiatry services are available by appointment 7 days a week. You can access virtual care directly through your Blue Cross online member account. Simply log in to start your virtual care benefits. You can learn more about the benefits of a Blue Cross online member account in the Member Resources portion of this presentation. While virtual care offers convenience, having a good relationship with your primary care provider is essential. A primary care provider, or a PCP, is a doctor of internal medicine, family practice, or general practice. Typically, this is the physician you see most. Your PCP gets to know you and they monitor the big picture of your health. And if they are an in-network PCP, they may also save you money. When you choose a PCP, you'll want to focus on network providers with a patient-centered medical home or PCMH distinction. A PCMH doctor leads a team of healthcare professionals who will work together to provide your care. If you don't already have a primary care provider, consider choosing one today. This is an essential step you should complete in order to get the most value from your plan. To find a provider in the PPO network, including a PCMH doctor or a participating durable medical equipment DME provider, visit bcbsm.com/findcare. If you don't have access to a computer, call 1-800-810-2583 and we'll help you find a provider. TTY users should call 711. Whether you see your own primary care provider or need after-hours care online or in person, you have choices for care that are always there. Your medical plan offers many valuable programs and resources. Now let's talk about how you can get the most value from your medical plan and help keep your costs down. You've likely heard about the importance of getting an annual physical. I want to highlight an important distinction between annual physical exams and annual wellness visits as well. A physical exam is a hands-on visit to assess your overall general health. Whether you're a Medicare member or non-Medicare member, your routine physical exam and standard routine labs are covered once per calendar year at no cost to you in the PPO network. However, if a sign or symptom of illness is discovered during an exam, all further testing and exams are considered diagnostic procedures and diagnostic out-of-pocket costs will apply. It's important to ask your doctor in advance what tests are performed with your physical exam. Annual wellness visits focus on preventive health planning and are a great way to review your health goals. This is not a hands-on exam. If you're a Medicare member, you can schedule an annual wellness visit once every calendar year as long as you've had Medicare Part B coverage for 12 months. The visit can be scheduled anytime during the calendar year. Starting January 1st, 2026, annual wellness visits for non-Medicare members will be covered once per calendar year at no cost to you when you use a network provider. Annual physicals and annual wellness visits are currently covered for Medicare members. While both are important, they serve different roles. Your resource guide helps you understand what to expect at each visit so you can schedule the right appointment for your needs. Now that we've covered how to stay proactive with your preventive care, let's talk about how you can be rewarded for prioritizing your health. Living Well is a program for non-Medicare retirees and covered family members. The program provides you with the tools to lead a healthier lifestyle while rewarding you for making healthy choices. If you're enrolled in Medicare, you're automatically enrolled in the retirement system's Living Well program, which gives you the lowest deductible, $800. Non-Medicare members can earn a deductible credit of $200 when they complete all the steps to enroll in the program. To enroll in the 2026 Living Well program, you must complete steps 1, 2, and 3 by December 31st, 2025. The first step is selecting a primary care provider or PCP. Whether you're enrolled in Medicare or not, one of the best things you can do for your health is to select a PCP. Keep in mind that a PCP is not a specialist. When you select your PCP, we strongly suggest you select a doctor that is part of a patient-centered medical home or PCMH. You can learn more about the benefits of using a PCMH doctor in the Choices for Care portion of this presentation. The second step of the program is to complete the Living Well Health Questionnaire. It has questions that can help you and your healthcare provider build a plan for you to live well. To complete step 3, you must complete a routine physical exam. The routine physical exam is covered in full when you use a PPO network primary care provider. Any physical exam completed during 2025 will count toward this step. If you've already had a physical exam in 2025, You've completed this step. Non-Medicare members will earn a deductible credit of $150 by completing steps 1 through 3. You can earn an additional $50 credit by choosing a PCMH doctor in step 1, resulting in a $200 deductible credit. This means you'll have an annual deductible of $800 for 2026. This slide is specifically for non-Medicare members. Again, Medicare members, you already have the lowest deductible and you're automatically enrolled in the Living Well program. Your retirement system medical plan offers personalized one-on-one support to help you manage a chronic or complex condition. The Blue Cross Coordinated Care Core program provides personalized support designed specifically for Medicare members at no additional cost to you. Led by a dedicated nurse care manager, this team works to coordinate your care, identify your unique healthcare needs and steps you can take to improve your health. Coordinate with other resources on the team to provide personalized support and provide ongoing support for chronic or complex healthcare conditions. To connect with a nurse care manager, call the Blue Cross Engagement Center at 1-800-775-2583 Monday through Friday from 8:30 a.m. to 6 p.m. Eastern Time. TTY users should call 711. Non-Medicare members have access to the Blue Cross Coordinated Care Advocate Program. Advocate is a program that will help make healthcare less complicated. A care advocate is a registered nurse who gets to know you and your care needs. You can turn to them with questions like, I left the ER with a recommendation to see a specialist. How do I find one? Or, what prep work can I expect to do before my surgery? At no additional cost to you, care advocates can help answer questions concerning medical diagnoses, test results, treatment plans, and more. Support you in making decisions about your medical care or in having challenging discussions about your medical and mental health care, and assist you with finding network providers, community resources, scheduling healthcare appointments, and setting medication reminders. The Advocate program will connect you with resources and services in your local community. To connect with a care advocate, call Blue Cross Customer Service at 1-800-422-9146 Monday through Friday from 8:30 a.m. to 5 p.m. Eastern Time. TTY users should call 711. Your retirement system health plan covers many vaccines to keep you healthy. As a Medicare Advantage health plan, the plan is required to cover all services, including vaccines that original Medicare covers. Some vaccines will be covered by your medical plan administered by Blue Cross, while other vaccines are covered by your prescription drug plan administered by OptumRx. The following vaccines are covered under the medical plan administered by Blue Cross: COVID-19 vaccine, hepatitis B vaccine, flu vaccine, and pneumonia vaccine. Take time to review the comprehensive vaccine coverage guide located at bcbsm.com/MPSERS. The guide outlines your medical and prescription drug plan vaccine coverage. Non-Medicare members have vaccines covered by Blue Cross and your prescription drug plan administered by OptumRx. Because vaccines are covered by both Blue Cross and OptumRx, you can present both membership cards before getting your vaccine. This dual coverage gives you more options for staying protected. Take time to review the comprehensive vaccine coverage guide located at bcbsm.com/MPSERS. The guide outlines your retirement system health plan vaccine coverage. You have a state-of-the-art routine hearing benefit program through True Hearing. Your routine hearing benefits remain the same for 2026. You have a comprehensive routine hearing care benefit which covers a routine hearing exam and a variety of hearing aid options once every 36 months. You have a $45 copay for the initial hearing exam. Hearing aids are categorized as advanced or premium based on the level of technology selected, and you pay a copay per hearing aid. You pay a $499 copay per hearing aid for the advanced hearing aids and a $799 copay per hearing aid for the premium hearing aids. The True Hearing benefit also includes a 60-day trial period, 80 batteries per aid, and 1 year of follow-up visits and a 3-year full manufacturer warranty on all devices. Remember, routine hearing exams and hearing aids are only covered through this program. You must see a True Hearing participating provider, and True Hearing needs to set up your initial appointment on your behalf. Please contact True Hearing at 1-855-205-6305 and follow the instructions you're given. TTY users should call 711. Navigating healthcare can be confusing, especially for members who are becoming Medicare eligible due to disability or because they'll be celebrating their 65th birthday soon. If you're transitioning into Medicare, we have a detailed online presentation specifically for you. The Basics of Medicare presentation covers the PPO plan, an overview of Medicare, information about how to enroll in Medicare, and your retirement system's Medicare Advantage plan, and a list of helpful resources for answering your questions. We want to make the process as smooth as possible for you. You can find the presentation at bcbsm.com/mpsers/4-members/webinars. We've talked at great length today about your retiree medical plan benefits, programs, and cost. You can also discover a world of digital tools designed to boost your well-being with Blue Cross. From fitness apps to mental health resources, unlock personalized support with a Blue Cross online member account. After you register for a Blue Cross online member account, you can easily access all your essential plan information in one secure place. Once you're logged into your online account, view claims and annual benefit documents such as your summary of benefits, use the Find a Doctor tool to search for PPO network providers, PCMH doctors, view quality designations, and get directions. Non-Medicare members can compare prices by provider, location, or facility using our cost calculator tool. You can also sign up to receive paperless explanation of benefit statements or EOBs and text message updates. Find your digital member ID card in a pinch and show it to your doctor's office. Easily order extra or replacement plastic cards. Tap into the power of digital wellness with Blue Cross Wellbeing resources, plus enjoy exclusive member discounts through Blue 365. If you don't have an online member account, it only takes a few minutes to register. Visit bcbsm.com/register and select Register today. Once you've created a login ID and password for your Blue Cross online member account, you'll use the same information to access the Blue Cross Blue Shield of Michigan mobile app. You'll see the same information when you log in to your member account on the website. If you need help with downloading the mobile app or using the mobile app, call the Blue Cross Web Support Team at 1-888-417-3479, Monday through Friday, 8 a.m. to 8 p.m. Eastern Time. TTY users should call 711. If you have questions about your retirement system medical plan, call 1-800-422-9146 Monday through Friday, 8:30 a.m. to 5 p.m. Eastern Time. TTY users should call 711. This number is also on the back of your Blue Cross member ID card. You can also find plan information online at bcbsm.com/MPSERS. Remember, if you have pension payment questions or need your address changed, you'll need to contact the Michigan Office of Retirement Services. Log into your ORS My Account at michigan.gov/ORS My Account to make the change, or contact ORS by phone at 1-800-381-5111. Thank you so much for joining us today. Take care and be well.